when you're diagnosed, particularly with type 1 diabetes, suddenly you're like thrust into disease land. Like you may never have thought about this disease in your life unless some relative or friend had it. Now you've got to learn everything about it as fast as you can, and you have no preconceptions. So his doctor explains to him, look, you don't make enough insulin, your pancreas is going to run out of insulin, and you need the insulin to metabolize these carbohydrates. Without them, your blood sugar will be too high, and you have all these chronic complications. So we want you to continue eating the carbohydrates, but you're going to eat, a measured amount at every meal and snack, and then we can dose the insulin to that. And then we're going to get a diabetes educator to teach you all about this. And he says to the doctor, wait a minute. What you're telling me is that because of this disease, carbohydrates are now toxic to me, and insulin is the antidote. And you want me to eat the toxin and take the antidote? Why don't I just not eat the toxin? And the doctor is like stunned by this. He's never thought about that. And then he starts giving all kinds of, well, that's really hard to do. You're never going to be able to keep it up. Nobody complies. But that's always been the sort of alternative therapy. This is a disorder that only manifests itself in response to the carbohydrates in the diet. We don't need to eat carbohydrates. We know from the last 20 years of clinical trials that not eating them is safe, if not the healthiest way to eat, depending on how you want to interpret those trials. And we now know that if patients with type 2 diabetes don't eat the carbohydrates, most of them will go into remission and not need drugs. So why don't we at least tell patients that that's a viable option? And in order to do that, we need the doctors to understand it. So that gets back to your question, the challenge. And the reason I wrote this book is to get the physicians and the diabetes educators and the diabetes associations to rethink the title, Rethinking Diabetes. Say, look, a lot of people are just going to want drugs. We all love a good drug, But if given the choice between being on, you think, okay, I'm going to start with one drug, but the other message you get is this is a chronic progressive disease. It's going to get worse. So people who start with one drug, what used to be called monotherapy, in 10 years are going to be on 2 or 3 drugs. If their blood pressure goes up, they're going to be on blood pressure lowering drugs. If their LDL goes up, or even if it doesn't, they're going to be on statins. If they've gained weight, they're going to be on GLP-1 agonists. A lot of people, and all these drugs have side effects and complications, so maybe some people just want to do the not eat the carbohydrate thing, which means they're basically on a ketogenic diet or a carnivore diet, or, you could do it as a vegan diet. It's difficult. And being healthy is a better option than slowing the progression of the disease. And if I can get the physician community to understand that, then they have to do their homework. They have to go down the rabbit hole and understand these diets. And now there's, a gazillion books. We've all written them that'll help them understand it. And then when their next patient is diagnosed, they could say, we have these 2 options. The conventional way, the ADA way, is, well, hopefully the ADA will be saying that, we're going to give you this drug and we're going to ask you to control your carb intake. And this other option is you're going to do this keto thing, not eat the carbs, and you'll probably lose 50 pounds and feel better. And we may never have to go to drug therapy. And then let the patients decide. But the doctors have to be able to give them informed advice.
And that's tough because, again, just the nature of medical care is not, I say it's not treatment-based, but it's not root cause based, I guess is a better way to put it. There's an issue. What's the fastest way to treatment? In an ideal world, what you would like to see is, and I'm just putting words in your mouth, is that you would see a carbohydrate restricted diet. And you said there's many ways to make it work, whether it's keto, carnivore, vegan, if they could do it with low carbohydrate, which seems pretty challenging. But in an ideal world, this would be an option, is basically what I'm hearing you saying, that we need to get healthcare providers. We need to get wise consumers and individuals that, because 100% of people eat, and getting it done in that fashion.
Yeah, and that's, I mean, none of this, every time there's a new drug, it makes it harder to get this message across. But the drugs are always treating symptoms. We have not invented the drug yet that cures this disease or cures obesity. Um, the yeah, it's just and it can all be tested, by the way. I mean, Verda Health in San Francisco, as I discussed in the book, did what I think is a pretty compelling trial showing that this diet can put diabetes into remission. It didn't show whether it was better than any other diet, but it did show that this one works and works in a way that nobody actually ever thought was possible. So yeah, that's the challenge now, and that's what the book was written to try and to help nudge along, because I recognize I'm not going to get rid of skepticism. Even the 1% or 0.1% of physicians who would make the effort to read a book like mine, when they're done, it's not going to remove their skepticism. But hopefully they will say to themselves, this is interesting. Like, let me try it. I remember giving a talk to a Cleveland Clinic conference. I was at their Las Vegas base, and I was talking right after lunch, and I ate before my talk, and then I got to watch all the cardiologists at the meeting walk up to get the very nice lunch that was all, salmon and skinless chicken breasts and vegetables. And I was watching them walk out, and they definitely looked like the sort of typical distribution of overweight and obesity among the public. A significant amount of them were struggling. And so try it yourself, learn what you can about it, understand it enough that you could communicate. I mean, the problem is if you're seeing a patient for 15 minutes, it's easier to write a prescription. Take this drug, I'll see you in a month, move on to the next patient. That's always going to be a problem. But then we have diabetes educators, the nutritionists and dietitians. I mean, it's crazy because this way of eating has now had more clinical trials testing it than any diet in history. And even the American Diabetes Association agrees it's better tested and more effective than any other diet that they promote. So they're coming around as slowly as humanly possible, because especially a health association doesn't want to say, oh, by the way, we made a mistake, or phrase anything in such a way that somebody else might go, wait a minute, this is entirely different from what you were saying 10 years ago.